Coronavirus. Facts, not fear, starts now.
Good evening. I'm Mike Montecalvo from WPRI in Providence, Rhode Island. Thank you very much for joining us. Now, early in the morning, Senate and White House negotiators reached a deal on a rescue package to inject nearly $2 trillion into the economy. Under the deal, most people would receive checks of up to $1,200, and married couples could see up to $2,400, depending on household income. An additional $500 would be sent to every child. It also boosts unemployment insurance benefits and provides billions of dollars worth of loans for distressed companies and small businesses. The House is likely to take at least 24 hours to read and debate the bill before taking a vote. The head of the coronavirus task force, Vice President Mike Pence, spoke with Washington, D.C. correspondent Anna Warnicki today about how the White House is battling the pandemic and when Americans can potentially expect to get back to normal.
Vice President Mike Pence says the White House struck a deal with Senate leaders on a massive $2 trillion coronavirus spending bill to help the people hit the hardest by the crisis.
It's going to speed financial support directly to American families and directly to small businesses that employ people all across this country.
Pence says once Congress passes the bill, the president is ready to sign it because he wants to see the nation back up and running sooner than later.
We can do this by Easter. I think that would be a great thing for our country.
Do you think Easter is a realistic timeline to get back to normal?
Well, so much of that depends on the American people. The most important thing that we can do for our economy, the most important thing to put this behind us is to prevent the spread of the coronavirus.
Pence says that means following the 15-day guideline the White House issued last week. Avoid social gatherings, wash your hands, and stay home as much as possible.
And Mr. Vice President, Americans are worried right now, understandably. How do you tell the single mom who's just been laid off and has to pay rent next week that it's going to be okay?
Well, I want to tell any American that's been laid off or lost their job or is worried about a paycheck that help is on the way.
Pence says that help depends on quick action by lawmakers in Congress. Currently, the Senate is expected to pass the bill by the end of the week. Then the House will have to take it up before it heads to the president's desk. In Washington, I'm Anna Warnicki.
Thank you, Anna. Shelter in place isn't just for civilians. Troops are also staying put. Defense Secretary Mark Esper has frozen the movements of all overseas troops for 60 days due to coronavirus. The freeze works in both directions. Troops who were supposed to come home will now have to wait, and the same is true for military personnel in the U.S. who were scheduled to deploy overseas. And all the freeze is expected to affect about 90,000 service members. In North Carolina, officials announced the state's first COVID-19 associated deaths. CBS 17's Angela Taylor joins us now live from Raleigh with the latest down south. Angela, what can you tell us about the deaths today?
Well, Mike, today Governor Roy Cooper announced that we've actually had 2 confirmed deaths associated with COVID-19. The first was a man in his 70s who had underlying medical conditions. The second was a woman in her 60s. She's not actually from North Carolina. She was just traveling through the area. She's from Virginia. So those are the 2 confirmed cases that we have in our state. Now, right now, we have more than 500 confirmed COVID-19 cases. And out of that, at least 29 people are hospitalized. So we wanted to know, are our local hospitals ready when more patients come in?
The U.S. healthcare system is projected to be overwhelmed by an influx of patients.
Soon we will be able to give you the number of hospital beds we have available, the number of ICU beds we have available across our state. We want that information and want to have that information so that we can be ready to set up additional hospitals if and when necessary in North Carolina.
According to numbers from the American Hospital Directory, North Carolina has 23,194 beds at 108 hospitals across the state.
There are certainly some unknowns. I think one of the knowns and one of the things that people can rely on is their hospital and health system is going to be there to take care of them.
Meanwhile, state health leaders are urging people with mild coronavirus symptoms to stay home.
If you feel sick and have mild symptoms, stay home and call your doctor. Your individual actions will help us slow the spread of the virus.
Earlier this month, Governor Cooper issued an executive order allowing our hospitals to add more beds as needed.
And we've contacted a bunch of our local hospitals to ask them what their capacity is. We're waiting to hear back. Hopefully we'll have that information for you tomorrow. Other new information we have out here in North Carolina today, Durham did issue a stay-at-home order. We're expecting Wake County and Orange County to issue something similar in the future. Of course, that means only non-essential stores will be open. Non-essential stores will have to close. So we are on week 2 of no school here in North Carolina, like much of the country, and kids aren't expected to go back until May 15th. But the teachers here are doing something to help out our local hospitals. School officials say a lot of equipment can be found in health rooms, including gloves, face masks, and gowns. They also hope to find hand sanitizer and wipes. So the staff and the bus drivers will visit nearly 200 schools this week to gather supplies. Items will then be donated to Wake County for emergency response efforts. And I'll end it with this. Plumbers say they are overwhelmed with people flushing things other than toilet paper down the toilet. So they just want to remind people that everything else needs to be thrown in the trash. Mike, back to you.
All right, Angela, thank you very much. In Rhode Island, the state now has a total of 132 positive cases with 16 people hospitalized. Today, the governor announced there are new guidelines coming to restrict the number of customers in stores. Kim Kalunian is in Providence now with more from the governor.
Well, the governor today not easing off her message to Rhode Islanders to social distance. Today, she announced some new mandates for big box retailers and also said she will not be reopening restaurants to dine-in customers anytime soon.
Rhode Island's number of coronavirus cases ticked up by 8 Wednesday, the lowest daily increase since March 17th.
There may be days that we have a lot more cases than today. What I'm very encouraged about is that we aren't seeing the spikes that other places are seeing.
To keep on track, Governor Gina Raimondo is calling on Rhode Islanders to continue social distancing efforts and ordering big box retailers like supermarkets to limit crowd sizes.
We are getting way too many reports of big box retail operations that have too many cars in the parking lot, too many people in the stores.
This evening, the Department of Business Regulation is set to release new guidelines for such stores. The governor says retailers will now have to count customers and keep them apart, clean more frequently, and increase access to online ordering. She says these new crowd control rules will be enforced by state and local police.
If we find that you're not complying, then I'm going to have to do something more extreme. Emergency regulations, greater penalties, closing more stores. And we really don't want to go there.
She's also asking customers to cooperate.
But please, if you're in the store and you find yourself in a line, you find yourself in a crowd, you shouldn't be doing that. It's not safe for you, it's not safe for your family, it's not safe for the other people in the line.
This as the governor says she does not plan to lift the ban on dine-in services at restaurants, something that was set to expire on Monday.
I can't imagine a world in which we're going to be able to reopen restaurants on Monday for in-room dining.
The governor said she will have more specific guidance on restaurants on Friday. Another issue the governor says she's monitoring closely, folks traveling to Rhode Island from New York, where the virus is spreading. She says she will likely have another announcement on that later in the week, but she says for now, anyone coming to Rhode Island from New York should self-quarantine for 14 days. At the State House, I'm Kim Kalunian, Eyewitness News.
Thank you, Kim. Stocks closed mostly higher at Wednesday's closing bell. It's the first back-to-back gain in weeks. The Dow finished the day up nearly 500 points, but the Nasdaq finished down 33 points. Officials believe the deal Congress agreed to has eased investors' fears for the time being. In Colorado, the governor making a big announcement tonight in an effort to continue social distancing efforts and stop the spread of the virus there. With more information from the Midwest, let's go live to Erica Gonzalez at KDVR in Denver. Erica?
Yeah, good evening, Mike. The governor of Colorado announcing today he is issuing a statewide stay-at-home order. He also applied for an emergency disaster declaration. He's waiting for approval from the White House on that for now. Meanwhile, we're also monitoring serious concerns over the possible exposure of the coronavirus at our local jails. We spoke with Jason Flores-Williams. He is a well-known civil rights attorney. He filed a lawsuit on behalf of one of his clients. He says that client has been denied sanitizer and is forced forced to stay with inmates who are showing symptoms of COVID-19. The city confirmed 23 inmates at the downtown detention center and 3 others at a county jail are under observation. No one has even been tested for the coronavirus so far. And also tonight, one of our biggest hospital systems is calling on the community for donations for that really badly needed protective personal equipment for healthcare workers. Fox 31's Kristen Hobrick has that story.
As the coronavirus continues to spread across Colorado, many medical professionals are already experiencing a shortage of personal protective equipment. That's why Centura Health has set up several donation sites.
Without that personal protective equipment, we risk taking out our frontline healthcare providers with that same illness.
Dr. Andrew French is an emergency medicine physician for Centura Health. He is seeing firsthand the spike in demand for personal protective gear amid the COVID-19 pandemic.
We expect this to go on for weeks to potentially months.
Dr. French is calling on the community to help donate masks, gloves, gowns, and protective eye gear, as some medical staff in different areas are being asked to re-wear the protective equipment during this shortage. So here's how you can help. Centura Health is only accepting boxed N95 masks, gloves still in the manufacturer packaging, packaged gowns or rain ponchos with sleeves, and face shields with eye protection. They cannot accept homemade masks. If you don't have medical supplies, you can still help by delivering catered food for on-duty caregivers and by donating blood.
We expect to see about a 35% decline in blood donations with what's going on right now, and that is going to still be a significant ongoing need.
There are 6 donation sites across Colorado. The donation bins are just right inside each of the hospitals. I put a full list of the locations on our website. Just head to kdvr.com. Reporting in Longmont, Kristen Hobrick, Fox 31.
And as for that statewide stay-at-home order that does begin tomorrow and should last through at least April 11th. Reporting in Denver, I'm Erica Gonzalez.
Erica, thank you very much. There are now more than 30,000 confirmed coronavirus cases in New York State. More than 103,000 New Yorkers have been tested for the coronavirus. New York State has by far the most confirmed cases in the nation. Now, in order to combat the virus, thousands of healthcare workers are stepping up to the plate to help out. WTEN's Karina Capabianca is in Albany now with more.
So far, more than 40,000 people have signed up to be a part of the healthcare surge team, and that includes more than 16,000 registered nurses.
You need staff understanding that some staff is going to get sick and they're going to be out. So we have been working on putting together a surge healthcare force.
The team will be made up of retired medical professionals or doctors and nurses who aren't currently practicing in a direct care capacity. The governor says those who have signed up could be put on possible reserve duty.
40,000 people have signed up. That's a big deal, because you can create beds, you can find the equipment, you have to have the staff.
Also announced today, more than 6,000 mental health professionals have registered to provide free mental health services. Anyone can call the hotline 1-844-863-9314 to schedule a free appointment.
We're all concerned about the immediate critical need, life and death of the immediate situation, which is right. But don't underestimate the emotional trauma that people are feeling and the emotional health issues.
The governor says the apex of the virus, where we could see the most strain on the healthcare system, could be in 21 days. Reporting in Albany, Karina Capabianca.
More than 10,700 Air and Army National Guard troops are currently responding to help with the coronavirus pandemic. As of Wednesday morning, 8 states have approved the use of dual status commanders. That gives them the authority to command active and reserve component troops under control of a state's governor. Now, National Guard tasks include delivering food, helping with screening and testing, providing transportation, and disinfecting and cleaning public spaces. Military leaders have made it a point to say the National Guard will not be imposing martial law. Starbucks is trying to help first responders get up and running in the morning as they deal with this crisis. The company says it's giving free coffee to those in the trenches of the battle against the virus. They include doctors, nurses, hospital staff, police officers, and firefighters. First responders can claim a tall-size coffee at any location that's still open until May 3rd. Finding a location, though, can be a challenge because many Starbucks stores are now closed, but some are still offering drive-through and delivery service. The coronavirus pandemic has threatened many independent restaurants and businesses. Many had to temporarily close or cut hours and staff due to the social distancing. Now there's a simple way to help them stay above water. The Yelp Foundation and GoFundMe have teamed up so that independent businesses can fundraise and get donations. They've made it easy too. The fundraisers will automatically appear on the Business Yelp page. Users just need to click on Donate to take action. Yelp and GoFundMe will match up to $1 million in donations. As cases of the coronavirus rise in California, officials there are setting up some relief programs for those feeling the impacts the most. Samantha Cortese and Andy Reesmeyer from KTLA are joining us now live to explain. Hi, guys.
Thanks, Mike. So nearly 2,900 people have tested positive for COVID-19 in California. 68 people have died. Here in LA County, the largest and most populous in the nation, 13 people have died from the virus. More than 800 have tested positive. In Southern California, the teenager who was reported to have died from COVID-19 yesterday is now not being counted. The CDC is investigating that further. The Department of Health is investigating at least 12 institutional settings for potential outbreaks. Statewide, many leaders are focusing on the homeless population to make sure the virus is not contracted and spread through there. Nearly 4,500 beds in trailers and rented hotels are now available to get homeless people off the streets.
And Mike, you mentioned that support from the government. Today, Governor Gavin Newsom pledged support to families, businesses, and healthcare workers. Almost all banks have agreed to a 90-day postponement on mortgage payments with no credit reporting for people who have been impacted by the crisis. New financial support has been pledged for the 1 million plus people who have filed for unemployment benefits in the last few days. The governor had good news for healthcare workers as well, who are worried about depleting supplies.
I want folks to know that we have already distributed 24.2 million N95 masks in the state of California. That is a significant number. It's still insignificant to meet our needs. I was very pleased today in our last briefing. We have now secured literally 100 million new N95 masks, which is not insignificant, but again, still requires us to secure and support additional procurement efforts.
Additionally, a Boeing 747 converted to a medical supply aircraft by Virgin CEO Richard Branson has been sent to Oakland, California after being stationed in China. On board are 1 million more masks and 100,000 testing kits.
In anticipation of a surge of new coronavirus cases, a federal medical station is being set up at the Riverside County Fairgrounds. That will include more than 100 beds, and KTLA's Chip Yost was at those fairgrounds as they got started in Indio with more.
You know, the Coachella Valley has been hit really hard with the coronavirus. All 7 deaths in Riverside County from COVID-19 have happened here. Now officials are getting ready for a possible surge in patients by setting up a temporary hospital in this building here. The fact that Riverside County's first federal medical station, or field hospital, is going up here in the Coachella Valley is no accident.
We are a vulnerable area for high mortality due to the coronavirus. That means that we have a high-risk demographics. Over 30% of our population are 60 years old and older.
To put an exclamation point on that, all 7 COVID-19 deaths in all of Riverside County have come from this area, and officials are expecting a surge in the number of sick people seeking treatment.
We expect there to be more cases and more serious cases, and this is part of the whole system to help with that surge.
The field hospital being set up inside this auditorium at the Riverside County Fairgrounds in Indio will hopefully help. It will hold 125 beds, half of the federal medical stations sent to Riverside County by the Trump administration. The other half will be set up later somewhere in western Riverside County. The idea is to free up beds at the permanent hospitals.
Our current hospitals will move patients who require a lower level of care to this facility. Now, potentially that could mean that there is somebody with COVID-19 who does require a lower level of care that could potentially be at this location. That, of course, all precautions would be made for isolation in that event.
Glenn and Lou, to put some of the out at the beginning in perspective, as of the numbers we have this afternoon, Orange County has more than twice the number of coronavirus cases as Riverside County does, yet Riverside County has 7 times as many deaths. That's because in Orange County right now they only have 1 reported death, at least as of earlier this afternoon. Here in Riverside County they have 7. So that's one of the things the congressman was talking about there, that they have a much more susceptible population to coronavirus here, which is why they're trying to get as many resources as possible in place. They do expect this temporary hospital to be set up within about 10 days. For now, reporting live in Indio, I'm Chip Yost, KTLA 5 News.
Unique because a lot of people think of Palm Springs as this fun, beautiful getaway, a vacation spot, and that is the heart of where that was all taking place. So a very elderly retirement community, and that's why Chip focused on it today.
Yeah, and here's some haunting video from a drone that was shot earlier today of Beverly Hills. Usually would be crowded with shoppers from all around the world. Right now, of course, no one is there. The area is home to many of the world's most exclusive retail stores, but since the stay-at-home order was issued, the streets have been nearly empty, except for a few security guards. More scenes like that, of course, all across the Southland, no doubt. From the West Coast, back to you.
Samantha, Andy, thank you very much. There are some simple steps you can take to help prevent the spread of COVID-19. You've heard this before, but it's worth repeating. Please wash your hands for at least 20 seconds and dry with a clean cloth towel or paper towel. If you don't have soap and water, use alcohol-based hand sanitizer. Cover your sneezes and coughs with either a tissue or the inside of your elbow. And of course, social distancing. That means staying at least 6 feet away from each other. Over the weekend, we'll be sitting down with doctors to get your key questions about the coronavirus answered. If you have a question, you can email it to coronaquestions@nexstar.tv. Your questions will be answered in Saturday and Sunday's live streams. Those streams will start at 4 p.m. Eastern Time. The goal of our Nexstar family is to make sure you continue to get the latest facts on the coronavirus without the fear. We'll be back at the same time tomorrow night with stories from across the country. For now, I'm Mike Montecalvo. Thank you for joining us and stay healthy.